very interesting paper and a very obviously very challenging problem for anyone who has the courage to tackle it. Are there questions from anyone? Please raise your hand, and I should think we encounter this problem more and more in contemporary society, do we not? Patricia, go ahead. Please unmute yourself.
Thank you, Carol. I really found your paper very, very interesting. Thanks a lot.
Thank you.
And very happy to be here with you. And just a little comment regarding what you presented, the case and the problem in general. In Italy, a recent research regarding adolescent people, and I was reading in these days actually, regard the problem of dysmorphia that you face in your paper and in your case, in your singular case. And it's becoming a sort of, I wouldn't say social problem, but it's growing. One of the signals of a malaise, a bad feeling of young people regards their relationship with their body. So they feel like dysmorphic when they're not. And so this is very strongly connected to anorexia and bulimic behaviors and unhappiness in general. And of course, this problem has become more evident and more, and the number has grown in the last 3 years after the pandemic, of course, but it's a long process. And then the pandemic, in my personal opinion, is just show in a very more evident the problem. So it's in a general consideration, the solution that not the solution, but the reflection that you share with us regarding the role of philosophy and philosophical counseling, it's crucial in my opinion, because it's a problem of relationship with the body, of acceptance of the life in general. As Lydia Mir, we discussed with her during the Romanian conference regarding this role of philosophy or philosophical counseling as a way of life to accept life as it is. And this is very important for a young person to appreciate, accept life as it is, which is a very, very strong point. And then another reflection that I trace from your beautiful talk, for your great paper, is the referring to Socrates, because I was rereading in these days also the Phaedo dialogue of Plato, and it's very interesting. It's very deep, the concept of body that Socrates body for me, for this reflection regarding the adolescence crisis, because it's a reveal of the value of a spirit. So a young person who has an enormous problem with a body which is not problematic at all shows a very strong problem with his mind, his spirit, his soul, which is Socrates says in Phaedo. The process of liberating the spirit and the soul from the body is not any dial of the body for me in Socrates. It's the importance of the body which is full of spirit. If the spirit flows out, you feel unhappy. So you have to respect your body and accept your body because it's made of spirit and mind. And the role of philosopher, of a good teacher, of a good society, in my opinion, is to value the spirit and the soul in our young people, which is because of many reasons of noosphere, as Lou would say, because of the noosphere of the digital world, and everything is just more difficult to put together. But it's very important. You touched a very important point. And the aesthetic around it, which is aesthetic in philosophy, it is an ethical value. So it's on top of the philosophical experience. Kant and Hegel put the aesthetic experience above all, logic and epistemology, and then aesthetics, because you appreciate the beauty of the world as it is. So thanks for your talk.
it's a prior concept. And one thing I didn't get into in the paper because it seemed to be leading me into a rabbit hole was the role of social media and in the digital world, because I think it's unquestionable that it's had this effect. I mean, that it's one of the factors that has led to the proliferation of this disorder. But I'm not sure if the disorder has really proliferated or if it's just more salient. And also, it's not only young people who are afflicted with this, it's also people of all ages. I mean, if you look at the intervention surrounding aging, Patrizia, I'm sure you can see that they're just as widespread as, you know, we find amongst the youth culture, you know.
Yeah,
but
I agree with you.
They're different specific pressures and concerns, but they are as pressing and as numerous, in my opinion. And also, and I think that perhaps we can thank, I don't know, the early Calvin Klein ads for this. I just read an article about it. But for some of this, but you know, we live in a very exhibitionistic culture, but perhaps there's been similar modes of exhibitionism, functionally similar in every culture, because this is something that human beings have to battle within themselves, you know, that certain kind of, I mean, narcissistic tendencies that one has to learn to temper as one goes through life. Freud talks about this, and many before him, and Plato too. We can go back to him if you like. So I would agree with you. I would just want to add that although we're seeing it more in younger people, because of things like TikTok and Instagram and so forth. And this kind of vanity, this kind of, and we might say dysmorphia can, I don't want to call it vanity, but let's say that the dysmorphia doesn't have to apply only to the body. Okay, yeah. It can do achievements, money, status, you know, anxiety. Status anxiety can be as crippling as body dysmorphia. And I would say structurally, they're the same. And that too, I think, has been exacerbated by social media. And of course, during the pandemic, these came to the foreground because everyone was obviously living online and communicating. Right. And so I don't think the problem will go away with the pandemic, because it's really created a new paradigm of communication and interacting. And in some ways it's very good because, well, we can to each other without, you know, with relative ease, without having to go through the inconveniences and indignities these days of trying to travel, you know, to get someplace at a specific time. So, you know, I'm not saying it's an entirely bad thing, but it has led to a new paradigm. And,
right.
And
Carol,
yes.
Could we move on to the next questioners? We can come back to Patricia if she has more to add. Vana and then Shanti. Okay, Vana, please unmute.
Just a very quick question. I work quite frequently with psychiatric patients and substance abuse patients, and body dysmorphia seems to be a big problem there because most psychotropic, I work with very severely ill people who have been hospitalized and then or in intensive outpatient programs. And so very often in analyzing how they ended up with this hospitalization and total dissolution of everything that they were working for, very often it turns out that it's a question of noncompliance with psychotropic meds that they really require for their stability, or in many cases with substance abusers, that they're using cocaine as a way of controlling their body image by becoming more slender. And this is very, very common. And I've been addressing it from kind of feminist perspectives and also indicating that these are usually rebellious people in some way. So that adopting these stereotypes is something that they don't, it's not really in harmony with their character and autonomy. But I was wondering how you would address those concerns with these clients.
These clients who abuse substances, you mean, and who do so often for reasons of bodily transformation. Well, first of all, let me mention that Matthew dabbles in those sorts of things too from time to time. I'm not sure if it's to change his body or if it's simply to transcend bodily experience. I know he does mushrooms and weed and things of that sort, but many do. But yeah, so I think it's the same thing. And by the way, I think that this is a serious condition, ultra serious body dysmorphia in all forms. It's two subforms too. Mm-hmm. And I didn't really discuss the second one of by proxy, but I think it's extremely complicated and bizarre. And it has a whole new layer of, psychological projection and problems of individuation and so forth. But with say, a person who uses cocaine, to take your example, to remain slender, or to have the energy. Some use it for extra energy so they can work out, or work more so they can be more successful and be seen as loftier than others. I think it's the same situation. I mean, one has to tackle it, in conjunction with psychiatric, clinical help. They probably do need psychotropic meds. Each case is different. I'm not a psychiatrist, so I can't say. And certainly, behavioral modification would be important as a start. But I think that with philosophy, you can see that first, you can help them see that there's a certain irony in the self-objectification, as I mentioned, because first of all, they're inflicting on themselves the very abuse they dread from others. And, I think that's an important point.
Yes.
And because many people, especially if they're addicts, are not swayed by reason. That's one problem. So that's one thing I would say is that, just to keep enforcing that kind of position that, and there's so many complexities involved with this. And as I said, it's widely underreported. We don't really know, or the demographers and epidemiologists don't really know what proportion of the population suffers with this, because they focus on the comorbidities, because the patients are so reticent about admitting to these things. So I don't know, what do you think of that? I mean, just, reinforcing the futility of it, because there's an intention that they're unintentionally sabotaging,
Hmm.
I don't know, what do you think?
I think that's a very good approach, and yeah. All right, thank you for that insight.
Well, thank you for the
Okay,
question.
that's great. And I have something similar to ask, but let's hear from Shanti. Please go ahead and unmute, Shanti.
Thank you very much for a really very informative presentation. I just was wondering, like, so where you started, right, was this body dysmorphia that is generally put into the DSM and is treated with cognitive behavioral therapy, and then also perhaps with some kind of psychotropic medication. And I'm just wondering, because I don't know you well, like how did you first start to go from that picture and start to morph out where the philosophical issues would be for a person that came in to see you? It's a change thinking, right? So how did that work for you? And maybe it was a gradual process with other clients, that this was just a natural progression. But in this kind of case, how do you start pulling those out?
That's a good question. I mean, each case is different. I'm not sure. I'm not sure I totally understand your question, because you seem to be asking two questions. One had to do with my own thought process, and the other with my method of working with Matthew, say. And I think that Matthew's idiosyncrasies, and of which he had many, made me simply target those that were most salient. And one thing that was, I think, quite important was his evasion, continual evasion. When he talked about an insecurity, he would always, in a sense, almost deny it or push it away by talking about a strength. So when he talked about some of his, if I may speak freely here, his sexual problems, he would often, or he will, let me put it, not just in the past, but his tendency is to then deny it, in a sense, by saying, "Oh, but so and so is always very happy. I always make her very happy, etc." And I mean, he can function sexually. It's not that he's dysfunctional. It's just that that too doesn't meet the ideal of, the endurance, let's say. He's concerned about his sexual endurance. And so this is, I guess if I should be more specific about that, given that we're all dealing here with, in a sense, psychological, philosophical views, but let's leave it at that. So I tried not to focus on those things too much. And when he talked about his size, for example, I didn't refer directly to that, but rather to his comparison with his father, his brother, with others he worked with. Because he would immediately, when he expressed these insecurities, he would again avoid it. It was almost as if he had blurted them out by accident. He would quickly move on to something else, like how well he was performing at this difficult job, which was, I mean, surprisingly physical for someone who had muscle dysmorphia. He had a job that was both technological, but also required a lot of, physical work. So It had to do with environmental issues and things like that. So that was one thing I did, is that I tried to focus on the points that he was moving to rather than what he couldn't talk about at that time, and then worked it around that way. And the work is not finished yet, so I can't really, I'm not sure, perhaps that's why my conclusion was so abrupt. But so that's how I've been approaching it. And, there's so many other problems that this is the foundation of. But I think that his embodiment is really at the foundation of all of it. And so, I've been working toward the foundation rather than starting there. Does that make sense to you, Shanti? I know you're an analyst, so you probably have things to.
Oh, I'm just happy to hear you talk about how you're proceeding, and you're a colleague and so respected. And I really wanted to understand, how you are approaching this person as a philosopher, and how you pulled out these kind of points that you were talking about, Aristotelian, some, the virtues, and like, when did you decide to put them in, and which ones? And
well, I decided because, well, first of all, he's quite cerebral, and he reads voraciously, listens to podcasts voraciously, speaking of the digital world. And also he prides himself on that. So it was easy. And since Aristotle is a particular interest of mine, and also I think that actually that one's life, one has a happier life if they become familiar with Plato and Aristotle. I think there's something to that. But if you have any suggestions from your point of view, Shanti, as a psychoanalyst, I'd love to hear them. And you can email me anytime. I mean, perhaps we can stay in touch that way. I'd appreciate that.
Great.
So,
That's a happy thought. So we're getting close to our lunch break. We can go on a little over because Patricia has her hand up. And Patricia, please unmute and ask your question briefly. And I'd still like to get my question in before we wrap up, if possible. So go ahead, Patricia, please.
Well, I was just wondering about the attribution of this being a case of body dysmorphia. Is that coming from you? Are you receiving this client from a practitioner that diagnosed him as DSM? Or, I mean,
No.
I'm wondering about the relationship between what might be considered body dysmorphia and just general self-concept dysmorphia.
Oh, well, that's a very good question. I guess it's well, first of all, he said he had body dysmorphia.
He did.
And that's what he said to me. And
Okay.
one of the hours I spoke, he said to me, I have some body dysmorphia. And then he moved away from that. And then he went back to it and said, well, by that I mean, and I said, well, what do you mean exactly? Why would someone look at you, what would they ever think?
Mm-hmm.
And he said that he felt he was, he told me he had body dysmorphia. Then he said later, when I asked him, well, what is the form of that surprises me? And he said, well, I'm not as athletic as my brother, who is very muscular. He's very well built naturally. He said, I have built myself up by working out. And so he used the term. And then as I read more about it and explored what this was, I realized that what he was talking about was that subtype of muscle dysmorphia. Now, I'm not a trained psychiatrist, and unfortunately, I'm not a trained psychoanalyst, although that is an aspiration of mine. But I think that that's probably, it seemed almost a classic case, like, right out of central casting. I'm not muscular enough. My brother is muscular and athletic. He's strong. I'm the smart one. He said, but so it was clear that he, as I read more about it, it seemed evident that to me, but I don't usually diagnose. I'm not, I wouldn't presume to diagnose.
I just think it's interesting to consider, the relationship of one's body to one's self. And I just wanted to understand how that came about. Yeah. Thank you. Thank you.
Thank you.
Okay, but before we break for lunch, I can't resist asking, because you kind of opened a Pandora's box in a way of possible. Yeah, well, I think it's very good for us, to contemplate this. I see a lot of contradiction in the phenomenon, because we have, on the one hand, deconstruction of beauty as it's traditionally been contemplated. We have all kinds of protests against it. On the other hand, the major companies that sell beauty-related and body-related enhancements are not going bankrupt, so there's still a pull in the direction that everyone's busy declaiming and being upset about. So we have now morbidly obese people who regard themselves as normal and don't want to be called that because they don't want to look in the mirror, presumably. So there's this pull and push going on. And I wanted to ask you, whether you think, for example, that since all the paradigms are shifting and all the institutions we received and inherited are being rearranged and rebuilt, so is it possible that, in your view, that body dysmorphias of various kinds are being expressed in this massive epidemic of tattooing and piercing that's going on with young people? Are they not also trying to reinvent themselves physically?
Yes, and I think that's a great point. And I was reluctant to even mention those things because let's call them ornamentations, embellishments, because I didn't know if, who here might enjoy those and getting those things. I mean, tattoos and so forth. I know people who are our contemporaries, Lou, who get tattoos, who have many tattoos, and piercings, and nose here, odd places, and some unseen places that, we might not want to think about. And I know people who've undergone some very strange procedures. But I do think it's an epidemic. I also think that globalization has had something to do with it, because when you talk about this universally accepted standard of beauty, or whatever the subjective standard of beauty, it's really not. I mean, going from culture to culture, place to place. And in a sense, we're very much like late antiquity, where we have populations from one culture pouring into another and, refusing to, or, to accommodate new standards. And then you find a fusion of standards. So I think that has a lot to do with it as well. That there's not quite the same, people go to an American, I might move to someplace in Africa and not want to assimilate. And then there's this gradually changes the standards within the foreign culture, the culture to which they immigrated. So I think that globalization, the whole that has created, contributed to this. But I also think that, these questions of social justice, and I think that this is one thing that may have, well, I shouldn't say, but delete the words I just uttered. But, many people do see it as a question of social justice, an act of defiance, act of feminism. I'm thinking of being in the arts, I'm thinking of, say, an artist like the French performance artist Orlan, who I don't know if any of you are familiar with her, but she has had probably more plastic surgery than anyone, but not to make herself more beautiful in the quote traditional sense. She's French, and she didn't want to look like a young Catherine Deneuve. On the contrary, she was trying to what she was doing was taking body features or facial features. Oddly, she has not had bodily enhancements that I can tell. But she's taken features from various women in the Western artistic tradition and had them imposed on her own face surgically. And in some of her exhibitions, we see stills of the surgical of the surgeries that she had videotaped and produced. And in fact, I once took an aesthetics class to see one of her exhibitions that was being shown in a gallery near campus. And one of my students ran out in horror. He had been a vet, an Iraq vet. And the idea that someone would mutilate themselves in this way, and the piercings and the so forth on her face, were to him so abhorrent. And the fact that it was, self-imposed. But yes, so I do think that this, and you mentioned a lot of different things. You mentioned the idea of these morbidly obese people who are not just refusing to see themselves as perhaps having health issues or, eventually developing health issues. But rather they are, we see them in lingerie ads.
Yes, sure, because there's money to be made from it. And the corporate world could care less if they drop dead 15 years ahead of the curve, as long as they can sell more products that conduce to it. It's just business as usual, pardon my cynicism. But what's clear and what's absolutely indisputable is that life expectancies are now lower in this country than they have been for 100 years. The curve is going south. And part of it is the culture of junk food and narcissism and all this other stuff, copious drug taking, very bad substances are being ingested. You know the story. But anyway, Carol, you've done a really interesting job in bringing this to our attention. And I think it's going to provoke a lot more thought from the philosophical counseling community about how we might want to weigh in. So thank you very much for this.
Well, I'd like to just mention one other point, because you mentioned life expectancy, Lou, declining rather than, which is certainly not what's supposed to happen in one of the wealthiest countries, developed countries in the world, right? But one reason it's declining is because of this almost epidemic of suicides. And the suicides are not unrelated to these bodily issues, as you may know, and the bullying that people experience as a result of it. And of course, when they respond by withdrawing the bullying, simply is exasperated. And so that, I think, is not irrelevant, actually, the increase in suicides and the lowering of, the lifespan, the decline of the lifespan I think that those are actually really fascinating connections that you drew.
Well, it's tragic, but I mean, it's statistically becoming significant because you're speaking about young people who kill themselves, and not people with a terminal illness or, asking for physician-assisted suicide. Talking about young suicides, but the leading causes of death in the USA are still heart disease, coronary artery disease. That's still ahead of cancer. And that's almost completely diet related in terms of what is driving it. Although there are heritable factors, you've opened up a very interesting field of inquiry for us with this talk. Many aspects of it are relevant. So I think we just want to thank you and show our appreciation for this. And I'm really curious about what you're doing with Japanese philosophy and glamour and other stuff, but we need to break for lunch. So let's email and keep us in the loop. Okay, Carol, thank you so much for the presentation.
Thank you very much.